Welcome to our virtual food safety training, and thank you all for making food safety a top priority. We recommend you also share this training with any of your volunteers or staff that handle food or help out with any part of the food distribution. This presentation will take about 45 minutes to complete and will fulfill your annual food safety requirements for Second Harvest. For those that complete this training, we will provide you with the ServSafe Food Handlers Manual, shown here, along with a certificate of completion. We are happy to mail it out to you if you can't pick one up at one of our 2 locations in San Carlos or San Jose. You'll find our email on the last slide of this presentation. Here's today's agenda. Your role in keeping food safe, good personal hygiene, receiving and storing food safely, evaluating and transporting food safely, and cleaning and sanitizing. So why is there so much focus on food safety? We're constantly seeing headlines like these on the news to remind us that the threat of getting sick is actually very real. From meat recalls to vegetables to packaged foods, all food can become vulnerable. Also, with our current situation, we are hearing about one of our most important preventative measures, hand washing. When we think of outbreaks, we also think of a large mass of people, but the CDC has defined a foodborne illness outbreak when 2 or more people get the same illness from the same contaminated food or drink. Now take a look at this food safety cycle. This cycle not only revolves around the proper procedures throughout the whole food handling process, but it's a lot about trust as well. When you come and pick up your food order or you have it delivered, you trust that our staff is carrying out the best food safety practices during every process. And when you are handing out food to your community, they also trust you, your agency, that you've handled this food in a safe manner. Therefore, they feel safe to eat it, knowing that they will not get sick. We all have to do our part. Who's at risk? 1 in 6 Americans get sick each year by consuming contaminated food or beverages. About half of the victims of food poisoning each year are either children under the age of 15 or seniors. Most often, a person experiences moderate symptoms for a few days, but then feels better. They often think maybe it was just something they ate, but symptoms do subside after a couple of days. However, food poisoning can be serious when it affects the most vulnerable. Think of the clients we serve. Most are a highly susceptible population. Those with a weakened immune system, over the age of 65, or those with an illness such as diabetes puts them at greater risk. In short, food poisoning can be more dangerous to your health than many people realize. How food becomes unsafe. Here are the top 3 hazards from the environment: biological hazard, physical hazard, and chemical hazard. For biological hazard, these are tiny forms of life that you can't see, you can't smell, and you can't taste. This includes bacteria, viruses, parasites, and fungus. Some of these can cause illness. They are called pathogens. Now, when we think of physical hazards, think of what you might find on food that doesn't quite belong there. This can include jewelry, glass, plastic, ceramics, and even bandages. They can also come from a food source, such as bones or egg shells. With chemicals, we know that they can contaminate food. These chemicals can include cleaners, sanitizers, and pesticides. Be sure to have any of these items clearly labeled and away from your food. Any one of these 3 environmental pathogens can contaminate food. Foodborne illness is almost always preventable. Following good food safety guidelines and knowing how we contaminate food is really important to preventing a foodborne illness outbreak. So now let's see how people make food unsafe. In this slide, we'll talk about the 2 hazards, poor personal hygiene and cross-contamination. Poor personal hygiene is anytime you transfer a pathogen from your body onto food. This can be from being sick, like coughing or sneezing near food. It can also be from poor hand washing. The number one cause of a foodborne outbreak is due to poor hand washing. With cross-contamination, you're transferring pathogens from one surface or food to another. An obvious example is maybe when you're in the kitchen using cutting boards, if you use the same board for raw chicken and then you're using it for ready-to-eat food without proper washing it, that's cross-contamination. However, in a food distribution setting, cross-contamination may not be so obvious like it is in the kitchen. Take a look at the picture on the lower right. Here we have raw chicken that's been properly bagged. However, at this distribution, the volunteer put the bagged chicken back into the contaminated boxes. These boxes may contain drippings from raw chicken that can be pretty harmful. So be sure to discard any raw meat boxes immediately. And please do not hand out any of these boxes to your clients for any reason. On these two slides, we'll cover time temperature abuse and poor cleaning and sanitizing. Letting food stay out too long is also a safety hazard. We recommend that you follow the best practices of letting food out at room temperature for a max of 2 hours. We also understand that as the need in our community grows, so does the length of our food distributions. So if you feel like you may need to keep your food out a bit longer than 2 hours at room temperature, we can help you by providing thermal blankets to keep your food cold and to keep it safe. With poor cleaning and sanitizing, it's important that all surfaces that come in contact with food get properly cleaned and sanitized. This is not limited to just kitchen areas. Think of tables that you may use, bags or boxes that you pack food in, even shared shopping carts to help clients carry foods into their car. Those shopping carts also need to be cleaned and sanitized. It's important for all of us to work together. We suggest even having a food safety lead volunteer at your site. This volunteer can assist with making sure all volunteers are using the safest practices. And remember, our nutrition team is here to answer any of your questions at any time. Understanding food allergies. We know that about 15 million Americans have a food allergy. The proteins that cause a reaction are called allergens. Here are the top 8 food allergens: tree nuts, peanuts, shellfish, wheat, dairy, eggs, soy, and fish. Even the tiniest speck of food can make people sick. We want to prevent cross-contact. Cross-contact happens when a food containing an allergen comes in contact with another food. This can be very dangerous for a client with a food allergy. Here are ways to prevent cross-contact and cross-contamination from a food allergen. Clean and sanitize surfaces that have come in contact with an allergen. Inspect food packages for leaks or spills that can cause cross-contact, and wash your hands and change your gloves. The current procedures in place for cross-contamination of an allergen is simple. Toss it out. We do not separate good from bad when damage to a product occurs and its content potentially leaks. Here's an example. The eggs that were delivered somehow got crushed. This caused egg whites or yolks to run into other cartons within the full case of eggs. This means that the whole case is now exposed to cross-contamination and should be tossed out as a whole. Allergens are very dangerous and cannot be taken lightly. Again, we do not separate at a site during distribution from good or bad. If an allergen has cross-contaminated other products because of damage to its container, please toss out the product. In this chapter, we will hear more about the importance of good personal hygiene. Now let's watch a quick food safety video. Hover over the screen to click play. I know we're hearing a whole lot about hand washing, and we're going to hear a lot more about it during this training. I think we do have it down that hand washing will help prevent the spread of viruses, but the one thing we don't hear on the news right now is that it's also very important in prevention of foodborne illnesses too. Be sure staff and volunteers have washed their hands for at least 20 seconds. Stocking the hand washing station. A stocked sink area should have hot and cold running water, liquid soap, single-use paper towel or a hand dryer, and you should have a garbage container nearby. If you do have a hand washing station available, make sure it does have the following. Having a single-use paper towel is also needed to open the bathroom door so you're not washing your hands and then possibly exposing them to a contaminated doorknob. Also, some of our partners have visits from our staff at the food bank, and we go over a form called the Agency Monitoring Form, where you will find a section about your hand washing station. So please be sure to keep up with this area daily. When to wash your hands. Make sure you're washing your hands after every switching task and after touching your face, especially your eyes, your nose, and mouth. Make sure your hand washing station is accessible to your staff and your volunteers and not used for storage like this picture on the right. And also make sure that you are not using it for anything else, like this picture here on the left. So what if there isn't a hand washing station available for you and your volunteers? We ask that you do have some type of hand antiseptic on hand, and remember to let it completely dry before touching food or equipment or putting gloves on. And also choose one with at least 60% alcohol. Wearing gloves while handling food is another safety step to help prevent the spread of illnesses and viruses. We ask that all volunteers wear gloves at all times while involved in the food distribution. This can be while boxing or bagging produce, preparing meals, and handing out food to clients. Wearing gloves ensures that no pathogens from your hands spread onto the food. Use gloves correctly. Gloves are meant to be single-use only. Make sure the gloves fit your hands properly. They should not be too tight or too loose. Never blow into your gloves. And if they're torn or dirty, be sure to replace them. Also, be sure to change your gloves if you've been using them for more than 4 consecutive hours, especially in the kitchen. Like we mentioned at the beginning of the training, jewelry can become a physical hazard when found in food. Jewelry such as rings and bracelets can also harbor harmful bacteria. That is why we ask you to remove most jewelry when in the kitchen, working in or around food handling areas. Here are some other important practices to remember. No eating or drinking in food handling or food storage areas. And be sure to report your illnesses if you're sick, or if you've been diagnosed with a foodborne illness or any other contagious illness. We all need to do our part to keep our vulnerable community safe and healthy. We ask that you stay home if you have a cough, fever, or are feeling ill. If you think you may have been exposed to a contagious virus such as COVID-19, or if you or someone in your household has been diagnosed with COVID-19, even if you are not showing any symptoms. It's also important to stay home and away from food and clients if you have symptoms of a foodborne illness. Here are some of the symptoms to look out for: vomiting, jaundice, sore throat with a fever, and diarrhea. Hepatitis A is an example of a viral infection that can be easily spread through direct contact and through food. We highlight the third point, that it is preventable with proper hand washing. So just another example of the importance of having good personal hygiene and always washing your hands. Everyone has heard of salmonella by now, but we highlight the severe cases. We spoke to this in the beginning of our training, how our clients may be more susceptible to illness and infection. The severe cases are more likely with infants, elderly, people with impaired immune system. In this chapter, we'll cover time and temperature, inspecting food, and storing food safely. We know that bacteria thrives under certain conditions, like when it's at room temperature. We also know that certain foods support more bacteria growth while other foods do not. If you give the bacteria the right food and the right temperature, these pathogens can double every 20 minutes. Controlling time and temperature. The temperature highlighted here is called the danger zone. It is the temperature that supports bacteria, also known as pathogens. You'll notice that if your food is not in the refrigerator or freezer or in the cooking process, it's most likely sitting in the danger zone. We recommend that perishable food stay in this temperature for a max of 2 hours if possible. Passive cooling, such as thermal blankets, can be used to maintain the desired temperature range to keep the cold chain unbroken. Controlling time and temperature. The cold chain refers to managing and maintaining safe temperatures of food during the entire process. The cold chain can be easily broken if temperature is not controlled during the supply chain. Some of these examples of when a cold chain can be broken are when you are picking up food from our warehouse or at a grocery store, long food distributions, and long drive time in an unrefrigerated vehicle. It's also important to be those extra set of eyes to inspect deliveries and be sure to reject any food that has not been received at the proper temperature. Here in this chart, you can see refrigerated food should be received at 41 degrees Fahrenheit. Frozen food should be frozen solid. Cut produce, 41 degrees Fahrenheit or lower, and whole produce at dry storage temperature. If you are an agency who picks up grocery rescue or is in the kitchen, you should use a thermometer. We have 3 different types here. The infrared only measures surface temperature of food and equipment. It displays the reading instantly, prevents cross-contamination because it doesn't touch food. The middle one is another digital thermometer. No need to be inserted deep into the food for accuracy, also displays the temperature quickly. The stemmed thermometer on the right can be inserted in food from the tip to the stem dimple. You must wait 15 seconds for the reading and is also easy to calibrate. Here are instructions on how to properly calibrate a thermometer. You want to mix the water and the ice well. Don't let the probe touch the container and wait 30 seconds until the indicator stops. Then, with using a wrench or other tool, adjust the thermometer to read 32 degrees Fahrenheit. During the COVID-19 crisis, we've had to make some quick changes with how our clients receive food. Some of the changes you may have already seen include food being pre-boxed, moving distributions outdoors, having a drive-through system, lots of social distancing, and volunteers using face coverings such as masks. Here are a couple pictures of our drive-through distributions. You see a lot of social distancing and all volunteers wearing face coverings. From time to time, we get questions about when is it okay to place food on the ground. As long as it's during the food distribution, which would be short term, it's safe to place boxed food on the ground. For pre-bagged produce, if a table is not available, which is the preferred method, it can be placed on a tarp or cardboard if placed on the ground. Remember, this is not for storage, just temporary during the food distribution. For more permanent food areas, such as pantries, food storage closets, and stockrooms, food must be stored at least 4 to 6 inches off the ground and away from the walls. This slide here better explains the storage situation of short-term and long-term. The picture of the pantry on the right shows how food should be off the floor and away from the walls. In the picture on the left, food can be temporarily placed on the ground during the food distribution. Occasionally, we'll see donations of bags come in, which can be very useful for us, our distributions, and our clients. Regardless where they come from, they should always be inspected prior to use. Any bags with these signs listed need to be discarded. Storing food safely. You can see here that the picture on the left shows the proper way to store food. Ready-to-eat food should always be above any raw meats. Use this rule as well when you are bagging or boxing food, or when a client shows up with their carts at your food distribution. Raw meats, such as poultry, should be the first thing clients put into their carts or in their bags so it can remain on the bottom of the other foods just in case it leaks. This is another way to prevent cross-contamination. We know 90% of people throw some food out too soon. and over half of us throw away food too soon on a regular basis. For the next few slides, we'll learn more about expiration dates and what these dates are really telling us. Here is a quote from Feeding America. Foods generally have dates on them that are based on quality. Accepting these foods after these dates is acceptable, as the food is still safe to eat. So that might still be a little confusing. This is telling us that these dates are not safety dates, rather than just telling us about the quality and the freshness of food. However, we know that things can also go bad before the expiration date. So if you're not sure about a food item that may look or smell odd, it's best to just toss it out. And if you're still a little confused, we have a great flyer that covers the expiration dates in simple terms. It comes in 4 languages for your agencies and for your clients. Here we have an example of when you may see use by dates. You can find use by dates on bacon, lunch meat, baby food, formula, and nutritional drinks. And what this means, the manufacturer cannot guarantee the nutritional value of the product after this date. Food is still safe to eat, with the exception of baby food and nutritional supplements, which should be thrown out on that date. Here are examples of the sell-by date. You can find it on bread, refrigerated food items such as milk, yogurt, cheese, eggs, and lunch meat. What it means, the store must sell these foods before the date listed. So it often donates foods to the food bank when it's close to its date. The food is still safe to eat and the quality is still good. And here we have the best by or best if used by date. You can find this on more dry goods, crackers, cookies, cereals, shelf-stable food. What this means, this date is the manufacturer's recommendation for how long the food will be at peak quality. After the quality date, the food is still going to be safe to eat, but slowly begins to lose nutrients and the quality begins to lessen. Rotating your food in storage. You'll want to check the date on your food items. Store food that will expire first in front of items that will expire later. Rotating your food storage will also help reduce food waste, keep food fresh and safe. Handling recalled food. We take food recalls very seriously here at Second Harvest. You'll get notified by email with recall information on how to follow the proper procedures if your site may have received such recalled food item. Here is a picture from our San Carlos Bing warehouse. This volunteer looked through all of these pallets of Kraft macaroni and cheese. There was a physical hazard recall because some may have contained metal shavings. And this volunteer did manage to find a handful of boxes that match the recall number. In this section, we'll discuss how you and your volunteers can help evaluate the condition of food and loading and distributing food safely. We will dive into canned food first. Which of these cans are safe? Yep, this can of corn is the only safe can here. So starting with the top left, if there is no label on it, it needs to get tossed. Some of our donations get received from the manufacturer with no labels on it too, but we're in contact with the companies and we make our own labels here. You may see the black and white paper labels from time to time. Those are made from us and they are safe to hand out as all the ingredients are listed on the label. The rusty can on the right, if you can't wipe off the light rust with a wet paper towel, then it too needs to get tossed. Rust eats up at the can, making it weaker to allow bacteria and air to enter. Any deep dents in the body or in the seam can also be harmful too, as it can allow air and bacteria to slowly enter the cans. And lastly, the bottom left, the swollen can. This has produced toxic gases that has now caused the can to bulge up. Please be sure to never distribute any cans that appear to be swollen or any of these bad conditions. What's wrong with this jar here? Dented lid. Discard any jars and bottles with these problems below. Dented, swollen, or rusted. Now let's see what's wrong with this box of pancake mix. there's gnaw marks. Gnaw marks on a package of dry food is a serious defect that could cause a foodborne illness. If you find any of these problems, be sure to look through your whole inventory. Also, if you believe that you received the food from us in this condition, take a picture of the damaged food, and please be sure to reach out to us. For the next few slides, we're going to talk about the quality of the produce. Most of the time, our fresh fruits and vegetables look beautiful and perfect, but there is going to be some times where it may not look like what you typically see at a grocery store. Most of the produce is what we refer to as number 2 quality, so not retail grade. So again, you might not see it at your grocery store. Cosmetic defects, and some unusual shapes and sizes. However, it's still going to be very delicious and safe to consume. Many products will require a closer look to see if they are usable. Never assume that a product is safe without inspecting it. By the time you receive the food into our warehouse to the time it gets into the hands of our clients, a lot can happen. The produce at the top of the box or the pallet may look perfectly fine, only to find out that the bottom produce is bad. This is why it's so important to have your volunteers to also look through the order. And if you're not sure about it, be sure to take a picture and contact us. Here you see some pictures of bad produce that we took out at sites. So what is the proposed quality standard at the food bank? Here is a rule to hopefully help simplify it all. It's called the 25% rule. So let's say you received produce, and let's say 25% or less looked bad. At that point, the site is expected to keep the order to sort and distribute. The site must look at most, if not all cases, to determine that percentage. Sites can still report back to the food bank when the product falls under 25%, and our staff can still report it on our issue tracker. So let's say you received produce and 25% or more looked bad. At this point, the site can determine whether to sort it or reject the product. We do encourage sites to sort when possible. Sites must look at all cases to determine percentage and be sure to take pictures. And the site should report it back to the food bank regarding the quality, and our staff must report it on our issue tracker. We would like to see the sites inspect at least 50% or more of the produce before making that decision and sending it back. And another reminder, please be sure to take pictures. So would you hand out this food to our clients? Probably not. Moldy food can also cause respiratory issues for some. And in this picture here of the strawberries, we ask that you not sort out the good and the bad and just toss out the whole plastic containers. With berries being very soft and containing a lot of moisture, the mold can root quickly and contaminate the whole package without it being visible. Any slits or cuts on soft produce needs to be discarded, or any opened containers or packages should also get tossed. A large handful of our agencies use their own personal vehicle to transport food. Let's make sure that we're loading and transporting food safely. We need to make sure the car is clean with adequate equipment, the correct storage to prevent cross-contamination, and let's keep driving time on unrefrigerated vehicles to under 30 minutes. Inspecting a delivery, what should you look for? The overall condition of the vehicle, signs of pests in the product or vehicle, condition of the product, door locks and seals that are in place, and the correct truck temperature. If you're unsure about any of these, please let us know. You may have caught something that we missed, and that can be a game changer when it comes to the safety of our food and the safety of our clients. Here are some more important reminders. Do not leave food outside or unsupervised. Do not put any food by garbage containers. Do not leave refrigerated or frozen food out at room temperature. And do not store raw meats or poultry over ready-to-eat foods. We've made it to the last chapter of our training, cleaning and sanitizing. We're going to cover how and when to clean and sanitize, handling garbage, and how to spot pests. So what's the difference between cleaning a surface and sanitizing a surface? When you clean, you're removing food and other dirt from the surface, so just what's visible to the eye. However, when you sanitize, you're reducing pathogens and germs on a surface to levels that's considered relatively safe. It's important to clean and sanitize in order to prevent the spread of pathogens to food. It also helps control pests such as insects and rodents. Be sure to clean and sanitize all surfaces that come into contact with food. This can be dishes and cutting boards, countertops, and microwaves. And also be sure to sanitize all frequently touched surfaces. This includes doorknobs, bathroom fixtures, and phones. This is especially important for those that work in the kitchen. So when to clean and sanitize food contact surfaces. Before and after use, when changing to a new product or between allergens, and after 4 hours if the item has been in constant use. These items can include knives and utensils, cutting boards, gloves, almost anything that is in constant use with food and the food prep area. Here is an easy sanitizing solution. 1 tablespoon of unscented bleach, 1 gallon of room temperature water. It's best to allow the solution to completely air dry or wait a few minutes before wiping down. You may also want to make a fresh batch every 24 hours and keep it in a closed container or a spray bottle. And remember, this is for food contact surfaces only. The CDC may have some different recommendations. Here are the steps to properly cleaning and sanitizing. First, you're going to want to scrape or remove food from the surface. Next, you're going to want to wash the surface. Next, you're going to want to rinse the surface. Then comes sanitizing. And last, you're going to want to allow the surface to air dry. Handling garbage. Remove garbage as quickly as possible. Be careful not to contaminate food or surfaces when removing garbage. Keep containers covered when they are not in use. Clean the inside and outside of garbage containers often. Do not clean garbage containers in clean rooms or food storage areas, and always wash hands after handling garbage. Handling garbage incorrectly will also attract pests, so please be sure to do this correctly. Insects and rodents are a food safety risk. They carry pathogens and diseases and can make people very sick. Insect parts can even be a source of physical contamination when found in or on food. Be sure to use all the preventative measures that we've shared during this training as a great preventative. Which are the signs of pests? It's important for us all to know the signs. Droppings, nests, and damage. It's important to also tell your director or supervisor if these signs are spotted. It's easy to prevent pests from entering your area, yet very hard and very stressful to get them out. So please be proactive, follow the safety steps to prevent pests from entering your site at all times. We realize this is a lot of information for you and your volunteers to remember, so we've created a food safety checklist. These checklists are great for you to use during your food distribution to ensure that all volunteers are following best practices. We currently have 2 available. Please take a minute to read through. This checklist here is more for direct service sites. Here is our second checklist. This one here is great for our agencies that may pick up food from us and that store their food in their pantry. We also can get both laminated for you if you want to review them and see which one fits your agency needs best. And this concludes our food safety training. Thank you for joining us. Again, if you would like our food safety manual or any additional resources such as flyers and posters, be sure to reach out to us. Our email is posted on the last slide. And thank you again for keeping our community safe and healthy.